Good afternoon, fellow students. Today I'll be talking about the rationale behind the use of tosarenib on mast cell tumors of dogs and examining the efficacy of this drug based on current studies and evidence. Firstly, I would like to talk about what is a mast cell tumor and why it is significant in veterinary medicine. Mast cell tumors are characterized by the highly invasive and metastatic activity and are the most frequent of all cutaneous tumors diagnosed. Furthermore, this is the most common skin or cutaneous tumor in dogs, accounting for about 70-21% of all dog skin tumors, and are commonly diagnosed in dogs over the age of 8. The prognostic factors involved mast cell tumors are the histological grade out of 3, with 1 being the least severe, the clinical stage, location, and finally the growth rate of the tumor. Therefore, the suitable treatment is dependent on the prognosis of the animal. Current treatment options for mast cell tumors are surgery, radiation, and chemotherapy. So, what is tosarenib? Palladia, which contains tosarenib, is the first FDA-approved drug for dogs. It is a small molecule tyrosine kinase inhibitor that can be taken up orally. This drug was originally developed as an anti-angiogenic agent with the aim to limit further growth of the tumor. This drug is indicated for grade 2 and grade 3 recurrent cutaneous mast cell tumors. Contraindications of this drug are pregnant, lactating, and breeding animals. How this drug works is by blocking the ATP binding site of several tyrosine kinase receptors, which are listed in the next slide. This causes prevention of subsequent downstream signal transduction and therefore ultimately limiting further growth of the tumor. The targets of this drug are listed here, and these targets are commonly involved with tumor angiogenesis and cell growth regulation. Side effects of this drug are gastrointestinal tract in origin, meaning side effects include vomiting, anorexia, lethargy, diarrhea, inaptitude, and ultimately weight loss. Alright, now we'll examine some studies displaying the efficacy of tosarenib. This study of the use of oral tosarenib phosphate for the treatment of dogs with non-resectable grade 2 and grade 3 mast cell tumor has demonstrated that this drug does indeed have biological activity against MCTs. However, even though this study has shown an objective response of 42.8%, the tumors regrew with a median time of 18.1 weeks and showed no significant effect in dogs with grade 3 tumors. Furthermore, this study did not examine survival rates. This next study is a phase 1 clinical trial that demonstrates how combining drugs that exert different mechanisms could improve the clinical outcome. In this study, it demonstrated the potential of using these two drugs listed in the title in combination to treat mast cell tumors. From this study, it displayed evidence of significant activity with an objective response of 71%, and the patient seemed to cope well. However, a prospective randomized study is further required to compare this combination with standard single-agent treatments to provide further information. Lastly, I want to quickly share with you some other studies on the future outlook for the use of tosarenib. In a 2014 study, it was observed that tosarenib may also prove useful in treating other solid tumors in dogs, such as metastatic osteosarcoma and carcinomas, showing clinical benefit of 74% in the 85 dogs that were observed. However, just like other drugs, a separate study showed that patients with recurrent tumor episodes will ultimately develop resistance to this drug. Furthermore, more and more studies and clinical trials are being done on the use of tosarenib in combination with other treatment options. In conclusion, tosarenib does show competence in treating mast cell tumors in dogs. However, further future research is required in maximizing the potency of this drug and minimizing the associated side effects by developing evidence-based treatment plans involving various modes of treatment. Lastly, it must be noted that this drug does show resistance in patients with recurrent tumors, and therefore treatment plans must take into account the patient's prognostic factors. Thank you.